Though the world has made important strides in reducing global hunger, nearly 870 million people are still undernourished, 1 out of every 8 people on the planet. About 165 million children under 5 suffer from stunting, or low height for their age, undermining their physical and cognitive development and perpetuating cycles of poverty across much of the planet. This is not a problem of food availability. The earth produces enough food to feed everyone. It is a problem of inequality. If a person is poor, a woman, a child, indigenous, or lives in a remote area, he or she is less likely to have a nutritious diet. People's race, gender, age, social status, or the place where they live can adversely affect their access to food and nutrition. And now climate change, which disproportionately affects the poorest and most marginalized communities, is creating new challenges for those that are already hungry.
Rosa maíz, siembra plátano, papachina, caña, y todo eso el agua se lo lleva, como ahorita vea. ¿Cuánto tiene que estar agua acá encima? Cuando seque, ya no tenemos nada más.
Tackling food insecurity and undernutrition is crucial to reducing poverty and inequalities. The MDG Achievement Fund was created in 2007 through a landmark agreement between the government of Spain and the United Nations. The MDG Achievement Fund supports joint programs in 24 countries where more than a third of the world's undernourished people live. These programs are using integrated approaches to help governments monitor their food situation and create policies that are improving the health and food security of vulnerable populations and reducing deaths caused by child hunger and poor nutrition. These programs intend to balance short-term health and nutrition needs with longer-term results, from urgently needed treatments for undernourished pregnant women and children to national policies to ensure universal access to food. Working with governments, civil society, the private sector, and, most importantly, with local communities, these programs have strengthened the 4 pillars of food security: increasing the availability and quality of food, improving people's access to it, promoting the use of good food, including breast milk, and building resilience to shocks and climate change. Availability. Farmers in Colombia are using organic techniques to produce good quality food.
Las ventajas que tiene mi cultivo es un cultivo limpio, un cultivo sano. Es un cultivo que si lo entendemos, eso es salud. Porque si yo tengo una buena comida, una comida no contaminada, esto es salud. Para mí, para mi familia.
Access. Nutrition and health surveillance systems guarantee that undernourished pregnant and breastfeeding women and children have access to nutritional supplements.
গর্ভবতী দুধদানকারী এবং 5 বছরের নিচে শিশুদের নিয়ে কাজ করা ও কিভাবে পরীক্ষা করি আমরা মনে করেন প্রথমে তাদের মুখটা মাপি
At the household level, programs are encouraging families to improve their nutrition by growing their own food.
ক্লাব হয়েছে যে আমার বাজার থেকে 2টা জিনিস মানে শাকসবজি আনাজপাতি এগুলো কিনতে হতো কিন্তু এখন আর কিনতে হয় না। খাদ্য পুষ্টি হিসেবে কিভাবে রান্না করতে হয় এগুলো আমি শিখেছি। প্রথমে মানে কিভাবে রান্না করতে হয়, আগে সাবান দিয়ে হাত ধুয়ে নিতে হয়, তারপর তরি-তরকারি ওগুলো আগে ধুয়ে নিতে হয়, তারপরে দিয়া যে বটি দিয়ে কুটবো ওই বটিটাকে ধুয়ে নিতে হয়, তারপরে এরকমের কুটে তারপরে রান্না করতে হয়। এটা মানে আমাদের ট্রেনিং এ শিখিয়েছে।
In Guinea-Bissau, where thousands of school children are getting hands-on instruction in good nutrition through school gardens, 11-year-old Ana Siwa was so inspired that she persuaded her mother to plant a garden at home. At the local and national level, in countries around the world, access to food and good nutrition is being incorporated into government policies.
Lideró el proceso del montaje del plan de seguridad alimentaria. En este momento estamos en el acompañamiento, ¿sí? Estamos en el proceso de que se hagan los planes de seguridad alimentaria a nivel municipal, ¿cierto? Y que desde ahí, de la base, hayan unos diagnósticos claros.
Promoting the use of good food. Programs are promoting the benefits of breast milk and making it easier for working mothers to nourish their babies.
Magpapasalamat lang ako sa kanila kasi may programang gano'n na hindi kami sinasantabi yung mga nanay nagbe-breastfeed. Bali lahat ng mga anak ko, lahat sila, mula sa panganay hanggang sa kanya, puro breastfeed talaga ako. Hindi sila sakitin. Kung sa pag-ano ng mga bata, yung ano nila, mental development, mataas yung ano nila.
Rooting initiatives in culture and traditional values helps ensure that good nutrition practices will be followed.
Vamos a tomar este chilate con cacao, que es costumbre de antepasados de los lencas. Venimos aquí como ancianos a demostrarles a los jóvenes que sí ansían saber las costumbres de antes.
During 3 years of operation, the MDG-Fund's nutrition programs have helped draft or revise 25 national nutrition plans, encouraged the planting of 270 school and community gardens and 757 home gardens, and improved the access to health of 534,000 citizens. Directly and indirectly, our contribution has improved the nutritional status of more than 900,000 children and 179,000 pregnant and breastfeeding mothers. While ensuring good health and nutrition is an ongoing global challenge, working with integrated holistic strategies that combine cultural sensitivity and environmental adaptability and that improve access to high-quality, secure food supplies for the hardest-to-reach people in the short and long term will help ensure that more of the world's children, women, and men live healthier lives.